If I can move on to our next speaker, Sophie Fleming. Sophie is going to talk about facial prosthetic rehabilitation. And Sophie is an Australian anaplastologist specializing in external prosthetic rehabilitation of the face and body. She's visiting prosthetist and member of the multidisciplinary craniofacial prosthetic and advanced rehabilitation team and comprehensive ear clinic at the Chris O'Brien Lifehouse, Sydney, Australia. Her private practice, Prosthetic Art Technology, serves a large geographic area of the Australian East Coast with satellite prosthetic clinics in Brisbane, Newcastle, and Sydney. She collaborates regularly with colleagues from several specialties, so we're seeing this multidisciplinary thing again, which is truly great to see. And she provides interdisciplinary treatment to people requiring facial prostheses at most major hospitals in Queensland and New South Wales. She has worked for many years alongside limb prosthetic facilities, providing custom silicone solutions to amputees. Sophie holds a Master of Science in Maxillofacial Prosthetic Rehabilitation from King's College, London, and is a member of the Institute of Maxillofacial Prosthetists and Technologists, the International Anaplastology Association, and the International Society for Maxillofacial Rehabilitation. She serves as co-chair on the IAA Clinical Anaplastology Guidelines Committee and is a member of the ISMR Facial Prosthetics Special Interest Group. She is passionate about reconstructive prosthetics and the wonderful people she serves in providing them. Thank you, Sophie.
Thank you so much. And gosh, it's such an honour to be here and talking with you all today. As you're aware, I'm just going to be talking about facial prosthetics after head and neck cancer. And yes, it's so true that multidisciplinary team approach is just such a big part of how we all work. And it's so wonderful that that is part of all of our treatment these days. I'll see if I can. So, as we're all aware, life-saving treatment for head and neck cancer, it can involve surgical removal of the affected part. So we've seen some photos previously, but this can mean loss of the eye, ear, nose, or any part of the face. So when surgical reconstruction is not possible, then prosthetic reconstruction can be a good option for people to consider. So I'll just go over some examples of prosthetics, a short history, and talk a little bit about the process of making prosthetics as well. So maxillofacial prosthetic rehabilitation involves restoration of the missing external hard or soft tissues in the craniofacial region. And anaplastology is a little offshoot of this, and the difference with that version of prosthetics provision is that we focus outside the mouth. So we're not dentally trained and we work above tissue level. So we're really focused on providing very realistic looking facial prostheses, which in turn is the function of the facial prostheses to restore that body part. So when we're talking about anaplastology, it's really interesting because it's really not very well known across the world or even in Australia, but it's a really, really old profession. And anyone that's heard me speak knows that I love talking about this woman, Anna Coleman-Ladd, in talking about the history of facial prosthetics. So she was a sculptor, but she set up the Red Cross studio for portrait masks in 1911 as a response to helping affected soldiers who had extreme facial injury during World War I. So what was really fantastic about Anna Coleman-Ladd and the team of people that she worked with is that not only did she make prosthetics, but she really worked on creating an environment and a space that made those soldiers feel comfortable and welcome. So with flowers and chocolates and games to play. And, you know, this was really important at a time when they felt quite socially isolated as a result of the extreme facial difference that they were suffering at the time. So there's a great video actually of her work on the Smithsonian website showing her and some very long bearded Ned Kelly types creating prostheses in black and white film. I encourage anyone to look at that. So her studio was lovingly described as the tin noses shop. And this is because the prostheses back in that time were actually made out of tin. Jumping forward to today, where we've obviously come forward in leaps and bounds, and the advent of silicone elastomers and bone anchored implants. And now we've got digital planning, and we're moving really quite quickly into the digital age of prosthetic provision. And that's really, moving forward with what's available today in terms of facial prosthetic reconstruction. And within that, and is this multidisciplinary team approach that we've all been talking about. And this is really because we know that the best outcomes come with a team approach. And much like Susan and Emma, with facial prosthetics, we will be involved with you sometimes before surgery to help with planning or discussion before your surgery, and sometimes after as well, or often after as well. So the wonderful Chris O'Brien Lifehouse has now established the craniofacial parts multidisciplinary team. And this is an Australian first, encompassing specialists from 11 disciplines. It's the only known MDT to integrate prosthetic rehabilitation for head and neck cancer. And this is a little quote that I really like by Helen Keller, and this is really what we hope to help people achieve with their facial prostheses after their long journey. So in talking about prosthetic types, or why someone would wear a prosthesis, so we mentioned that this is because usually it's because a facial part has been removed as a result of cancer treatment. And this is an example of this type of facial prosthetic treatment here. And we consider this to be an assistive technology tool. And this is a really lovely gentleman that has obviously had his eye and his nose removed. And he was quite comfortable actually after his surgery, but he was looking for something that he could wear when he went out and about, mainly to take his grandkids to the movies, but also just to allow him choice over how he wanted to be responded to in social situations. So he was able to have his prosthesis as a tool to be used if he wanted or if he didn't want to have a certain kind of response to him. So a prosthesis is never attached permanently to the body. They're always something that's put on and taken off daily. And each one is custom made for each individual. So it's a little bit like everyone's a different puzzle. So part of our job is just figuring out the anatomy and the puzzle of that person to help create a prosthesis. So there are a few typical presentations that we might see somebody for a facial prosthesis for. This is somebody that's had an orbital exenteration. That means that they've had their eye and the surrounding tissues removed, their eyelids. And for that, we would make an orbital prosthesis, such as this one here. A nasal prosthesis is usually as a result of what's called a rhinectomy, and that's when you need to have your nose removed to treat nasal cancer. And this is a gentleman here. I love this photo. This is him with his partner. They met after he had his rhinectomy, but before he had his nasal prosthesis. And they were able to go through his prosthetic journey together, and just a really lovely story of life after head and neck cancer. We make prosthetic ears for people that have had their ear removed as a result of cancer. And these are aesthetic, but they're also functional in the sense that they help hold up glasses. And if the ear canal exists, they also help to capture sound as well. So in terms of prosthetics, we also, part of our assessment when we work with someone and meet you to have a prosthesis made, we'll think about how that prosthesis may be attached to the body. And there's a number of different methods that we'll go through in a second. But this one's where we have implants placed into the bone. And this is part of what Dr. Lowe's presentation was, which is where there's an amount of planning that needs to be done within the team to ensure that the implants are placed in the best position and the prosthesis may be attached. So there are limitations to prosthetics. There, as there are pros and cons to all forms of reconstruction. The limitations for prostheses are that they're not living tissue, so they do have a lifespan. They do wear out over time. They don't blink or move or have an innate defense system like the body. They won't change colour as the skin does. And in terms of cost, we don't yet in Australia have a comprehensive funding program for prosthetics, facial prosthetics, unlike limbs or breasts. There is different funding available, but it's not yet consolidated, and it's not well, you know, we're yet to get that easily accessible for people. However, after major head and neck surgery, a prosthesis is a valuable tool for social rehabilitation. It offers choice, it offers protection for delicate tissues, and it really helps to empower to start living the new normal following head and neck cancer. So this is a little video that we made and was published on the what is now the Head and Neck Cancer website, previously known as Beyond 5. And this is a great resource for anyone wanting to learn about the process of having a prosthesis made. I've just chopped it up a bit and made it a lot shorter, just to really illustrate the types of prostheses available and the retention methods. And I'll go through that very, very quickly right now. So after we first meet with someone, we, as I said, we figure out the retention method or how the prosthesis is held on. So we can have adhesive, where it becomes a stick-on type prosthesis, and that's where we'll place some glue onto the prosthesis and the skin, and it will be stuck into position and worn all day like this. We can attach it to spectacles, and this is kind of known as it's a bit of an old-fashioned method, but it's still really useful. It's a fast and easy way to wear a prosthesis, and it's helpful if your dexterity is not fantastic. And bone anchored implants that we chatted a little bit about before, where the implants are placed into the bone. They have a component that comes through the skin, and the prosthesis just snaps into position. So to make the prosthesis, we'll see you for a number of consultations, usually 3 or 4. The first consult will be the assessment, but we also might take an impression of the affected area using a little bit of silicone. This is a very gentle and non-invasive process, and this helps to give us a plaster model of your face. And from that plaster model, we'll go and sculpt a wax prototype of whatever part is missing. With that wax prototype, we will then place that into position on you, and you get to be very much involved in the shape of the prosthesis. So we really encourage people to give us feedback on whether they want the projection of the nose changed or the width, and it can be a very personalised part of the process. We'll make a mould of that wax prototype and fill that with coloured silicone that's been matched to that patient's skin. After it's cooked in an oven, we will then do a little bit of external colouring with things like veins and freckles to really make that prosthesis look very much like you. We'll seal that prosthesis in, and the final consult is to hand the prosthesis over, but also importantly to train you in how to use the prosthesis, how to apply and remove it yourself, how to clean and care for it, and we'll talk about any follow-ups that might be needed. So sometimes, and this is the gentleman wearing his adhesive retained nose. So sometimes it can be a really simple journey for people, and we make their prosthesis and away they go, and other times it can be a little bit complex, but we kind of work together for a period of time to resolve any issues that they may have with the adhesive or learning how to apply the prosthesis, whether they need some extra support at home before you're kind of up and running with your prosthesis. And then after that, we might see you once every 6 months to do a colour touch-up and keep the prosthesis looking good, and make an assessment as to whether that needs to be replaced as well. So in conclusion, prosthetics can be really useful for those that can't or don't wish to undergo further surgery. If you're interested in having a prosthesis, you can contact your GP or specialist for a referral, or just get in touch with us. And we can also put you in touch with people that have gone through the prosthetic process themselves, if you're interested in learning to hear what it might be like to wear a prosthesis in everyday life and what the process is like from a patient perspective. So thank you so much for having me here tonight. It was so great to talk to you. There's contact details here on the page, and I look forward to the chat at the end of this talk.
Thank you very much, Sophie. Again, what an impressive talk. I had no idea that prosthetics could be as realistic as the ones you've shown. So credit to you and your profession and all the work you do.
Thank you so much.